Welcome to the deep dive. Today we're jumping into, well, one of the most persistent, maybe frustrating, but really critical health questions out there. How do you truly lose belly fat?
Right. And we need to be clear what we mean by belly fat.
Exactly,
Yeah.
because people aren't usually just talking about the soft layer you can pinch under the skin,
Mm-hmm.
that subcutaneous fat.
Mm-hmm.
They mean the deep stuff, the dangerous fat packed around your vital organs,
Yeah.
liver, heart, pancreas. We're talking visceral adipose tissue, VAT.
Yeah, and that distinction is absolutely critical because VAT isn't just like inert stored energy. It's basically acting like a metabolically active organ itself.
An organ. But a dangerous one, you're saying.
A very dangerous one. Think of it like a little factory inside you that's constantly churning out stuff that drives systemic inflammation.
Okay, tell us more about that factory. What's it actually
Mhm.
manufacturing? What makes it so toxic?
It's actively secreting these chemical messengers, specifically inflammatory cytokines, things like interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha.
Oh.
And these chemicals, plus free fatty acids, they get dumped directly into the portal circulation,
Which goes straight to the liver, right?
straight to the liver. And this overload, it messes with the liver's ability to handle glucose and metabolism properly. It really sets off this cascade leading to insulin resistance and, yeah, a much higher risk of cardiovascular disease.
So shrinking VAT isn't just about how you look. It's about, like, shutting down that internal inflammation factory.
Precisely, pulling the plug on it.
And the common wisdom, the thing you always hear, is that the answer is duration.
Hmm.
Long, steady cardio, an hour walk, a gentle jog.
Right. The assumption is just racking up calorie burn over time is the best way.
Yeah, that seems intuitive.
It does, but our sources, and we're talking rigorous meta-analyses, clinical studies really focusing just on VAT, they show something different. When you specifically want to dismantle that inflammatory factory, duration often isn't the most effective lever.
Oh, interesting.
Yeah, the evidence points pretty strongly towards high-intensity interval training, HIIT, as being one of the most effective ways to reduce visceral fat, often actually getting better results than traditional moderate intensity programs.
Okay, let's unpack that then. Why intensity over duration for this specific type of fat?
Let's do it.
So if VAT is kind of locking the body into this bad cycle, this metabolic dysfunction, how does a short burst, like maybe a 20-minute HIIA session, actually interrupt that cycle, like right away?
Well, it tackles the root problem, which is often the muscle's inability to handle glucose efficiently, insulin resistance at the muscle level.
Okay.
HI8 dramatically improves that insulin sensitivity, and it boosts glucose uptake in your skeletal muscle. Think about your big muscles, thigh, glutes. A single HII session can activate these specific cellular gates within those muscle cells.
Ah, you're talking about those GLUT4 transporters we read about.
Exactly those. Think of them like specialized doors or vacuum cleaners on the muscle cell surface. HIIT flips a switch, opens those doors wide.
And they start sucking glucose out of the bloodstream.
Precisely, pulling it right into the muscle cell for immediate fuel or to be stored as glycogen. And what's really fascinating is how long this effect lasts.
How long are we talking?
One 20-minute HIIT session can keep those GLUT4 gates open and highly active for like 24, sometimes even up to 48 hours after you finish exercising.
Wow, that's incredible staying power from such a short workout.
It really is.
So instead of glucose just floating around, eventually getting stored as liver fat, or worse, adding to that VAT,
Yeah.
HIIT basically reroutes it straight into the muscles.
Exactly. You're clearing the metabolic traffic jam by opening up this huge parking lot in the muscles for glucose. Takes the pressure right off the liver and pancreas.
Okay, so clearing glucose traffic is step one. Let's talk step two, the intensity itself.
Yeah.
HIIT means pushing into that anaerobic zone, right, where your muscles need more oxygen than you can supply right then.
Yeah, that's the core of it.
What actually happens in the body during that temporary oxygen debt?
Okay, so when you hit that anaerobic zone, your body has to, well, metabolically speaking, it has to panic a little bit.
Panic.
Yeah, it needs fuel now, like within seconds, because the normal oxygen-based energy system can't keep up. So it burns through stored glycogen really fast and, crucially, uses the phosphocreatine PCR system. That's your body's instant fuel for powerful bursts.
Like a biological turbo boost.
Kind of, yeah. And that brief, intense metabolic stress is what triggers these really powerful systemic adaptations that you just don't get, or not nearly as much, from steady, moderate exercise.
So the panic itself drives the change. What are the main adaptations?
Okay, two big ones. First, you trigger something called EPC, excess post-exercise oxygen consumption.
EPRC. Heard of that? The afterburn effect.
That's the one. After the intense work stops, your body keeps burning extra oxygen for hours, sometimes even a day or more. It's working hard to restore its energy systems, clear out metabolic waste, repair tissues, basically paying back that oxygen debt it incurred.
So it's like you used a metabolic credit card during the sprint.
Uh-huh.
And now you're spending hours afterwards, even while resting, burning extra fuel just to pay off the balance.
That's a perfect analogy.
Yeah.
The body's furnace just runs hotter for a while because of that short, intense stress.
Okay, that makes sense. What's the second major effect? You mentioned hormones.
Yes. And this is where it gets really interesting for targeting visceral fat specifically. That intense effort stimulates a big surge of catecholamines, that's adrenaline and noradrenaline, plus growth hormone.
Okay, powerful stuff.
Very powerful. These are potent, fast-acting, fat-mobilizing hormones.
Right, the body's hitting the alarm button.
Right.
But okay, playing devil's advocate, if I hate that I'm still burning calories, how does HIE specifically target the visceral fat?
That is the million-dollar question, right? And it comes down to the actual structure of the fat cells. Visceral adipocytes, the fat cells making up VAT, are biologically different from subcutaneous fat cells. They are uniquely packed, really dense, with something called beta-adrenergic receptors.
Beta-adrenergic receptors.
Okay.
So if adrenaline and noradrenaline are the signal.
Then the VAT cells have way more antennas listening for that specific signal.
Got it.
They are incredibly sensitive to that hormonal surge from HIIT. When adrenaline floods the system, these VAT cells respond almost immediately. They start releasing their stored fat into the bloodstream to be used for fuel.
And the subcutaneous fat, the stuff under the skin.
It has fewer of those beta receptors, so it's just less responsive to that specific release fat now, signal triggered by the intense bursts.
Okay, so that biological difference explains why studies show VAT shrinking significantly with HIIT, even if someone's overall weight doesn't change much or the pinchable fat stays similar.
Exactly. It's a targeted mobilization. You're hitting the fat depot that's most receptive to those intense hormonal signals first.
That's really powerful. You could be getting significantly healthier metabolically without seeing huge changes on the scale initially.
Absolutely. It's about internal health first.
Okay, let's shift to the long game then. It sounds like HIIT isn't just about burning fat during the workout, but changing the body's infrastructure. To stop fat coming back, that brings us back to muscle, doesn't it?
Yes, absolutely. You're essentially investing in your metabolic infrastructure. Skeletal muscle is the primary place your body disposes of glucose.
The main glucose sink.
The main sink, yeah. So every bit of additional muscle, or even just metabolically healthier muscle, acts like a permanent grain for glucose and fatty acids. And HIIT is really effective at preserving and often even slightly increasing lean muscle mass, especially compared to long cardio, which can sometimes be catabolic if nutrition isn't right.
Okay, but hang on. If I'm only doing, say, 20 minutes of HIIT a few times a week, realistically, how much muscle am I building? Is it enough to actually change my baseline metabolism, my BMR, in a meaningful way?
That's a really fair question. You're not going to build, bodybuilder levels of mass with just HIIT, but it's significant for metabolic health. It's not just about sheer mass, it's also about muscle quality.
Quality, how so?
HIIT improves the muscle's ability to actually use fuel efficiently, what we call metabolic flexibility. But yes, even preserving the muscle you have is crucial, and HIIT does that well.
And why is preserving muscle so key?
Well, 3 main reasons. First, muscle burns calories even when you're sitting still, so it raises your basal metabolic rate, your BMR. Maybe not massively from HIIT alone, but it helps.
Okay.
Second, muscle is in direct competition with fat for energy. The better your muscles get at sucking up that glucose, like we talked about with GLUT4.
The less glucose is left floating around to potentially get stored as VAT.
Exactly. Less opportunity for V8 expansion. And third, that improved metabolic flexibility means your body gets much better at switching between burning carbs and burning fat for fuel, which is really a hallmark of a healthy metabolism. HIIT trains your body to tap into fat stores more readily, even when you're not exercising intensely.
So pulling that together, HIIT is like a cellular and infrastructural upgrade. It changes your physiology, making your body less likely to store fat in those dangerous visceral areas to begin with. It's like a reprogramming.
It really is reprogramming the system, making fat storage less likely and boosting your resting energy burn.
Okay, let's get practical. We're thinking about the learner, someone who needs efficiency. Time is often the biggest barrier, right? That hour-long run just doesn't happen consistently for many people.
Definitely. And that's a huge advantage for HIIT adherence. You can get a really high-quality, effective session done in just 10 to 20 minutes.
Using simple moves, too, often.
Yeah, bodyweight squats, sprints in place, maybe stairs, push-ups, minimal or no equipment needed. This high-reward, low-time commitment thing, it makes a massive difference in people actually sticking with it.
And the clinical evidence backs this up, that short duration, like 15 minutes, say, 3 times a week, can that actually move the needle on VAT levels?
Oh, absolutely. The data is quite compelling. Studies show that even just 2 or 3 HIIT sessions a week can lead to significant clinical improvements. Reductions in VAT of like 20 to 30% over a few months are seen in some studies. And when researchers do these big meta-analyses comparing all sorts of exercise types, vigorous intensity exercise and HIIT consistently come out on top or near the top for effectiveness, specifically in shrinking V8.
What about comparing it directly to moderate intensity continuous training, or MICT, like that steady jogging? A lot of people prefer that. They don't like the feeling of going all out. Does MICT still work for VO?
That's a good point, because MICT does work. It's definitely beneficial for overall fitness and can reduce V2.
So is the extra intensity of HIA worth the discomfort for some people?
Well, where HIIT often wins is efficiency and potentially targeted effects. For example, one study directly comparing HIIT and MICT in cardiac patients found both reduced overall VA significantly, which is great.
Okay.
But the HIIT group tended to show a greater reduction specifically in liver fat. And since fatty liver is such a huge driver of metabolic problems,
That extra reduction is a really big win.
a major win. So yes, the intensity might be uncomfortable briefly, but you're potentially getting a more potent, targeted hormonal and metabolic effect in just minutes, compared to needing maybe an hour of moderate effort for a lesser or at least different effect on things like liver fat.
Okay, makes sense. So for someone listening right now thinking, all right, I want to try this, I want to start reprogramming.
Yeah.
What's a safe, practical way to begin? How do you hit that necessary intensity?
First step, always, is a proper warm-up. Get the muscles ready. Then, a really common starter template uses a work-to-rest ratio designed to let you recover enough to go hard again.
Okay.
So you might aim for, say, 30 seconds of fast, all-out effort. That could be sprinting on the spot, fast bodyweight squats, running upstairs quickly, going hard on a bike.
The key being all out.
Yes. You should be breathless, finding it hard to speak in full sentences by the end of that 30 seconds. That's a good intensity marker.
Right, the talk test. If you can chat, you're not working hard enough for the interval.
Exactly. Then you follow that 30 seconds of hard work with 90 seconds of active recovery.
Active recovery meaning?
Gentle movement, like walking slowly, very light pedaling, just enough to catch your breath and let your heart rate come down a bit so you're ready for the next intense interval.
Okay, 30 seconds on, 90 seconds easy. And you just repeat that.
Repeat that cycle, yeah. Maybe 8 to 10 times to start.
Mm-hmm.
That gives you a total workout time of about 15 to 20 minutes, plus your warm-up and cool-down.
Sounds manageable.
Yeah.
And scalable, I guess.
Very scalable. But the key is making sure those 30-second bursts are truly high intensity for you.
And safety precautions.
Yeah.
Especially for someone maybe starting exercise after a break.
Crucial. Always include a good 5-minute warm-up before and a cool-down after. And this is vital. If you have any known heart conditions, high blood pressure, diabetes, or other significant health issues, you absolutely must talk to your doctor or clinician before starting HIIT.
Right.
While HIIT can be, and often is, safely adapted even for people in cardiac rehab, it needs to be done appropriately for those individuals, often under supervision initially.
Okay, good advice. So let's tie this all together. What's the big picture? When we look at the metabolic science and the practical side, the main takeaway seems to be that HIIT works because it's more than just burning calories. It's a systemic intervention.
Yeah, I think that's a great way to put it. It's a cellular systemic intervention. You're not just chipping away at calories hour by hour. You're using these controlled bursts of high stress to fundamentally reprogram your metabolism at a deeper level.
And that reprogramming, by hitting visceral fat hard, has knock-on effects beyond just fat loss.
Profound effects, yeah, beyond the scale. Because you're preferentially burning that pro-inflammatory visceral fat, you're effectively getting a systemic reset of your body's inflammatory tone.
Resetting inflammation. What does that look like clinically?
We see measurable improvements, things like lower levels of high-sensitivity C-reactive protein, or hsCRP, which is a key marker of inflammation, reduced circulating IL-6, and really importantly, improvements in endothelial function.
The health of the blood vessel lining.
Exactly. Basically, how well your arteries can relax and contract. Better endothelial function means more flexible, healthier blood vessels, lower cardiovascular risk.
So the improvement is really internal, cellular, not just cosmetic. You're literally turning down the inflammation dial in your body.
That's right. And this might explain something fascinating that the source materials often mention.
What was that?
Patients frequently report feeling subjectively lighter or sharper. They notice differences in their daily energy levels, their mental focus, often before they see significant changes on the bathroom scale.
Because the internal metabolic and inflammatory environment is improving first.
Possibly, yes. HIIT trains the body to burn fat more effectively, 2547, and VAT is the first, most responsive fat to get mobilized by those HIIT-induced signals. The internal reset might happen before the external changes are obvious.
Okay, that leads perfectly into our final provocative thought for you, the listener, to mull over. If HEAT really does train your body to preferentially burn its most dangerous metabolically active fat first, and if shrinking that fat fundamentally dials down inflammation and resets your system, what specific, maybe subtle, non-physical changes might you notice first? Think about your daily energy consistency, your mood, your mental clarity or focus. Could those be the very first signs that your cellular metabolic profile is improving, even before the scale or the measuring tape budges? Keep an eye out for those quiet benefits as your body potentially begins its inflammatory reset.